I'm Jacky. I'm 57, 58 next week, and I'm from Gloucestershire. My experience of cancer is that I had primary breast cancer in 2016. I had a reoccurrence in 2018. Then in 2021, I was diagnosed with secondary breast cancer. No, actually, I didn't. I didn't. I went to see the oncologist, and he said, "Let's just do another scan, before we sign you off as such." And then the scan came back, and he gave me a phone call, which was a little bit out of the blue. I didn't expect it to say, "Actually, your cancer has spread. So now this is secondary breast cancer." I was very shocked, very because it was lockdown, so I had a telephone call. I didn't expect it at all. Yeah, that was a bit of a shock. I knew bits of it. I wasn't totally naive. I knew if I had a pain somewhere, maybe to go back. I was quite kind of maybe I was on super alert, um, but I didn't have any pain. I didn't have anything really. So yeah, it was something and nothing, but it was something big, if you know what I mean. I just thought, nah, it's probably going to come back. This is just to sign me off. This is just for me to get on with my life now. And oh, isn't he good? Isn't he good doing an extra scan? I don't know why I did it. Maybe it was the bloods. I wouldn't have known that at the time. And yeah, it did. And then I had that phone call, which was kind of devastating because I just didn't expect it. It was like a big blow.
What happened next?
So my husband was sat next to me when I had the phone call, and we kind of just looked at each other, but we were kind of numb. Is this really happening? Is it? Does this doesn't happen to us? This won't happen to me. Um, and he kind of just went off and did tea, and I'm sat there thinking, what's going on? And I think it probably took a good 48 hours for us to process it, because it was out of the blue. We didn't. It just wasn't processing. So yeah. So I'd already had a lumpectomy with primary breast cancer, and I had a mastectomy with the reoccurrence. So because it was just on the other side in the lymph node, my first thought was, oh, they'll just take it out. It's abs because operations just take it away. And I was a little bit shocked to find out actually because it's spread, we don't do any operations, and that's how it worked. And it's like, no, because you've took a lumpectomy out, you took my breast off. Can you just not take the lymph node out? Um, and and I did go for a second opinion, but the census was, you need to go for treatment. After the treatment, I did go for another second opinion, and then I had a DIEP flap, had skin taken from my back, and my chest wall was taken out. So I did have the operation in the end, and I was no evidence of disease for a while, but actually they didn't get clear margins. So I was told quite quickly that it would come back at some point because there was still some cancer, but I just enjoyed my life while I didn't have it. And it did come back, but that wasn't so much of a shock. I feel okay actually because I've kind of got my head around it. Um, I know this is a cliche, but life is worth living, and I have a choice. I have a choice to live my life panicking and worrying. When I say I have a choice, I'm going to be honest, the choice is taken away. I don't have a choice because you can't help but feel when you have a scan, or when you even though if you've got stage 4 cancer, another pain, it's, oh God, it's gone somewhere else. So, but I kind of think, okay, if it happens, I'll need to deal with it. Um, I'm saying that as if I'm really calm, but at that time, I think, yeah, I'll deal with that. And then I have a dark moment, and then I think, oh gosh. But then I think, no, pick yourself up because I'm still alive and I'm still well, and there's so much to do in life. Just go ahead and do it. That's how I deal with it. I'm not saying it's the right thing or the wrong thing, but I think it's really important to have a really strong mind. Um, but I'm not trained in my mind. My mind wanders off, but I try to bring it back. that's quite a strange question, really. Good question, but a strange question. The misconceptions could be if it's, I think people that don't understand about cancer and it, they don't know the right things to say, and I get that, I do get that. But it's visualization as well, isn't it? It's if you kind of like lost your hair, it's like you've got really terrible cancer as such. But if you still got your hair and you're still on treatment, you can feel equally as terrible. So I think it's really difficult to say what are the misconceptions, because people have different experiences. People have family members that have had cancer. People have family members that have never had cancer, or best friends. So I think sometimes it's really difficult to navigate that. Sometimes you just don't want to answer at all and you want to pretend you haven't got it. And sometimes people ask the most ridiculous questions, but actually it's not their fault because they don't understand it. So I kind of think the more awareness about cancer is really, really good. Just for people to get an understanding. But I think there'll always be a misconception no matter what, but it's good for awareness. I would probably say it's going to be emotional. That's really difficult because it's how you are as a person. So how I would deal with cancer, somebody differently would deal with it. So the only advice I could give is process it. Take your time, process it, deal with it how you would deal with it. Get a community around you, get some support. If you haven't got the support, that's okay. That's okay. You can still go through it. Just do your best. It's not your fault. Don't beat yourself up. Did I eat this or did I do that? Did I not do exercise? Did I work too hard? Did I have a stressful job? Did I have don't worry about it. This is a time now for you to stop and think of yourself and put yourself first. Be strong. Let people make decisions for you, but equally make your own decisions as well. Yeah, that's my thoughts on it. I think it's important for, like I said, awareness. I think awareness is really important. And it's not just the scars on the outside, it's the scars on the inside. And if the photo can tell a story, then it's good. It's good. It's visually, to look at it is good. And hopefully it will capture the emotions and the feelings. Like I said, everybody's different. Everybody deals with it differently. There's not a right or a wrong way, but the photo will tell the story. And that's their way. And that's their way of dealing with it. And that's my way. I'm quite happy to show my scars, show my warts and all, because I'm not going to be ashamed that I've got breast cancer. This is me. This is who I am. Unfortunately, I've got stage 4. But fortunately, I'm living a lovely life. So let's combine it.